Hi, I'm Chris Coombs, and this is The Truth in Diabetes, hanging out with some friends and family up at beautiful Causey Reservoir today. So the other day, a friend of mine, Sean, said, Chris, so I watch your videos, that's great, I have a question for you. What do I do if a person with diabetes, apparently he knows someone that he's had to dump food or juice, whatever, down their throat a couple times. What do I do? How do I know what to do for that person if a person with diabetes is having a problem? Well, some pointers for you on that one, Sean, or anybody else that's following this blog that might be learning about how to help somebody that has diabetes. Well, the first thing that you need to determine is that person experiencing a high or a low blood sugar. Hyperglycemia, that is a high blood sugar. Hypoglycemia, that is a low blood sugar. So what are they? Are they high or are they low? The first thing to do there is to talk with that person. If you're a good diabetic and prepared, you have your meter with you. That's something that you need to do. It is your job as a person living with diabetes to train those people around you as far as what you need if there is a problem. So that is step number one. Is it an option to test their blood sugar? Okay, so what are you looking for? Average normal blood sugar, 80 to 120. If you're below that, that's low. If you're above that, you're high. So that's what you're trying to figure out. What do they need? Well, if you got a high blood sugar, what do you do for that? It is people's tendency that if a person with diabetes is experiencing high blood sugar, here, let's give you some food. Eat, 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 eat. You'll experience that. That's the last thing a person with high blood sugar needs is more food. That could push them towards DKA or a coma. The other thing is, you need a shot. Well, if a person is experiencing a low blood sugar, they don't need someone giving them a shot of insulin. So that's the first thing you look for. Now, on high blood sugars, the biggest thing you're going to notice in a person experiencing a problem with diabetes is mood changes. That person's normally lucid, but if they start getting queasy, they start getting tired, they're not themselves. They become irritable, grumpy, ready to bite your face off. They're not normally like that. Maybe they are, hopefully not all the time, or no one would want to be around them anyway. That's the first thing to determine. High, low. Somebody's high. You need to look at getting them some insulin or maybe even getting them to the hospital, because if that blood sugar is high enough, they're going to need an IV with fluid and insulin dripping into that. Now, the other side of that, low blood sugar. If that person is conversing and talking with you, chances are they're going to be able to swallow. That's the first thing to look at there. If they can swallow, that's when you need to get them something sugary. And again, this is something that a person with diabetes, it's always a good idea to never go anywhere without your meter and a glucose source. You need your blood sugar meter to check your blood sugars, you need your insulin in case you need that, and then you need sugar in case you're low. The other thing, and in case of extreme low blood sugar, if that person can't swallow, obviously you don't want to suffocate them trying to pour juice down their throat, is what's called a glucagon kit. Not too many diabetics actually carry this around with them, but it is an option. And what is glucagon? Well, for lack of a better explanation and just to dumb it down a little bit to somebody that might know, it is an intense sugar that is injectable. Usually it comes in a little kit. There's a needle there and 2 vials. One of those vials is liquid, the other one is powder. You poke that syringe into the liquid, draw up the liquid, squirt the liquid into the powder, roll that around in your hands, mix it up, draw it up, boom, you can inject it. The other thing, if they're at that point, they can't swallow, glucagon kit not an option, that's when you need to call 911 and get that person some help immediately. Okay, so anyway, that's a quick summertime tip for you, but this one really can apply to any time of the year. Make sure that you're teaching the people around you some basics. This is what I need if I'm high, this is what I need if I'm low, this is how you perform a simple blood sugar test, here's where my sugar is if I need something so you can get to it quickly. So anyway, there it is. Just a quick summertime tip for you. Hope you're having a fabulous summer. Remember, take care of yourself and take care of your diabetes, because disease or destiny, my friends, it's your choice.